Hello everyone, welcome to webinar series. Shanti here this side, and today's topic for discussion is all about donor milk for preterm nutrition. Of course, the donor milk is from the maternal mothers. Yes, we are fortunate to have a very well set up milk bank with excellent infrastructure and with the advanced technology. And I must say that it functions under the able leadership of Dr. Pamela Dev Roy ji, who is our consultant neonatologist pediatrician from and milk bank lead from Yashoda Hospital, Secondabad unit. I welcome you, ma'am. And we all are very privileged and honored to have you with us today.
Thank you. Thank you so much.
And also, I like to extend my welcome for all the panelist speakers, who is Dr. Lalita, and she's educator and counselor from Yashoda Hospital, Secondabad unit. We have Priya from GNGH Hospital, Charminar, and we do have Kezia George from Neonatal Intensive Care Unit from Yashoda Hospital, Malakpet. And going forward, this session is going to be very time bound, and let us see what we have in the rest of the discussion. Yes, I think Priya, you should take this lead of the slide. Yes, over to you, Priya. Yes.
Yeah, thank you so much, ma'am. First of all, I would like to thank you for this opportunity, and we are really excited to know better insights from you, ma'am, because this topic is a very newer thing, and as I am into the government sector, this really helps us to know much better because while especially counseling the mothers and for us to know better and to counsel them, this really builds a huge gap between both the practicing nurses and as well the mothers as well. Thank you so much, ma'am. Coming to the basic statistics, ma'am, as the premature births are more globally. Suppose if 13.5 millions are births are there annually globally, and only almost 3.5 millions are in India itself. Ma'am, do you find is there like there is a rapid demand in the past decade for this donor milk, ma'am? Human pasteurized human donor milk. Do you find there is a rapid demand of this donor milk, ma'am? As it's increasing, maybe
Definitely.
it might
Definitely.
be the maternal reasons. Yeah,
Yeah.
ma'am, we would like
No.
to yes.
Yeah.
Please, ma'am, take over and give your insights to us.
So definitely, like over the last few decades, there has been a huge improvement in the infrastructure of the neonatal care, and with this, the like survival of preterm and sick babies have improved a lot. Previously, we never used to hear 26 weeker or 27 weeker surviving. But now even
Yes,
24 weeker is surviving. Any baby above 24 weeks babies, like we are resuscitating, we are keeping in an ICU, and we are successfully discharging these babies. So there has been a great shift. So obviously with this shift, with the more surviving of these preterm babies, there has been a huge increase in the demand of the donor milk, because in this
yes,
extreme premature babies, most of the times the mother will have some comorbidity, or mother will be in some other hospital where we don't get the mother's own milk. Previously we used to keep these babies nil orally till we get the milk, or till these babies are big enough to give formula.
Yes.
So
yes.
there was a huge gap in between, which has been covered up now by this human donor milk.
Oh,
Yes. So, Priya, are you convinced? Because I am convinced, and yes,
yes,
because
ma'am. Yes, personally, yes. Because as Madam said, over a decade, when I was having my first child, I haven't heard this concept, ma'am, frankly speaking. And till 2 days of the initial delivery days, I was not able to produce the milk. Though the baby is not preterm, everything went on well, but there was a gap there, and we haven't heard this concept at all. And coming to the attitude of mothers, madam, in your in and out practice, like how would be the attitude of mothers towards this donor milk, madam, because in our sector, in most of the government sector, we really find very difficult to trace the donor as well and to convince the recipient as well. Both the areas we really find huge difficulty. So how would in and out in your practice, ma'am? How do you find mothers' attitude towards this, ma'am?
Yeah, definitely. Till date, I would say it is not like in our society, still it is lacking the consciousness level. Few people, like it has improved a lot, definitely, but still there are many people who come and ask that will it be safe to give? No, we will not give. We will keep NPO only. The babies will keep Nilorally and all. But with the increasing like awareness, education, and the spread of information, there has been a huge improvement in the awareness. And now mothers are coming voluntarily to donate.
Oh,
Actually, we
that's
are having lot and lot of antenatal and postnatal mothers who are willing to donate. Then our like mothers of preterm babies who initially the babies will be needing some 2 ml 3 ml, so they are
yes,
producing lot of milk. So with continuous awareness and with continuous education, that continue expressing your milk, do not restrict. What we tell personally is like you do not follow how much milk the baby is getting, you do not concentrate on
Yes.
that, you just keep on expressing
yes,
how much ever milk you get, you give to us. We will give whatever is needed for the baby, and remaining we can keep in the milk bank so that some other baby can get. So, with the increasing awareness and education, there has been a huge, huge shift in the mentality of the mothers, the families. So, they are coming up with voluntary donation. Even we are getting lot of outside mothers who are donating willingly, and obviously the receiving tendency has also hugely increased. But we have to continue this awareness,
yes,
and like we have to
Very good.
keep on educating the people.
yes. So, yes, a very productive insight and information you have provided that the mother should not focus how much a baby is drinking, and she should, continuously expressing and donate. As that was a very well said statement. Yes, unless like when we begin with the topic, we should always begin with this definition. Yes, we have an ICU nurse, Kezia, who is presenting this slide. Kezia, over to you.
Good evening, everyone. My name is Kezia, working as a staff nurse in the Malak Page unit. So I'm glad to be a part of this webinar, and I'm having an opportunity to learn and to discuss this important topic about with you all. And my question is, ma'am, what is actually a donor human milk? And actually, it should be an awareness video to all the mothers, to all the educated and also the uneducated mothers. So I would like to ask you, what is the exact, or to be tell me in briefly, what is donor human?
So donor human milk is definitely mother's milk, mother's breast milk, which is donated by a lactating mother voluntarily for any baby other than her own baby. So that we
Yes,
call as donor human milk. Now, here I would like to add one sentence. In previous years, or
Yes.
even like few years back, also people had the concept that any neighborhood mother, if she is also a breastfeeding or lactating mother, they will get the milk from that. Or
yes,
if any other mother from the relative is they will get the milk from them. So that is also donor human milk. But what we do call now, or what we mean by donor human milk now, is actually pasteurized donor human milk, which is the best option actually. So we
yes,
don't know whether that
Yes.
other mother is serologically negative, HIV,
yes,
hepatitis
Yes.
B,
yes,
HCV can be there, or some other illness, some chronic illness can be there. So why to risk the other baby? Might be
yes,
for that mother, that specific baby is having the optimum milk, but it doesn't mean that for the other baby it will be optimum. So what we are doing is the donor milk is being pasteurized, and it is being made suitable for all other babies. So that is
Yes,
called as
yes,
like pasteurized donor human milk, which is the actual term.
yes,
Thank you, ma'am.
yes, yeah,
And I would like to ask another question, ma'am. Why it is important and recommended for the premature babies and also for the low birth weight babies?
Yes, it is definitely recommended. It is highly and like 100% evidence based. Organizations like WHO, NNF, everyone suggests that. Obviously, the first option is the mother's own milk. So, if
yes,
the mother's own milk is not available, the next best option is this pasteurized donor human milk.
yes,
And then comes the third option, like formula or any other thing, if both these
yes,
two are not there. So,
yes.
this thing is evidence based and this is recommended for premature babies.
Yes. So after knowing the real definition, now we are just going to discuss about the few flow of process at our setup. I think this is also very important. And as we promised to all our audiences that we are going to keep our session very time bound. Yes. Priya, the other side, you would like to take the slide. Yes. Priya, over to you.
Yeah, ma'am. Here comes a crucial part in the processing of this milk. As you said, not unlike before, this is totally different. It's a pasteurized human donor milk that itself goes through is so much of process, right, ma'am? So
Yes.
comparatively to the mother who willingly comes and approaches to give her milk as to donate the milk. But I usually with counseling, you'll start up with the procedure, right, ma'am? So, what would be the most of the challenges we face in counseling, ma'am? Because here the donation part or receiving part doesn't really depend only on the mother itself, because it includes the family as well. So, how do you manage that particular part, ma'am? Because that plays a major role to receive the milk and to make sure that it has been processed and it has been given to the a baby which is in need. So for this step, how do you give us your valuable insights, ma'am? How to manage and to counsel properly at the area of like receiving the donor part, managing the family and all? Could you please help us with
Yes.
this, ma'am?
So just a minute here, I would like to interfere because I think I happen to see this milk bank set up at our facility, and I happen to speak to Lalita also. She's the one. One day I was just passing by and she showed me everything, and we like to also involve Lalita, who is Dr. Lalita, and a few little this process she can just explain us. Yes, Lalita, over to you. Yes.
Yeah. Hi.
Yeah, ma'am.
So let's start with the donor. First, once we get the donor milk from the mother, so first we will explain the mother how to store the milk properly. It's not like normal in the normal fridge we have to keep it and all that. So there has to
Yes.
be separate deep freezer where the mother can store. And from the mother we will be collecting it. And how to store in the sterile bottles or in the sterile milk packets which are available online. Mother can just buy, and otherwise we will provide from our hospital, and then we will store it properly. And then we will get from the mother's doorstep, we will get it to the hospital with the proper consent and screening, as Pamela ma'am said, with the proper virology report, serology reports, and everything is normal. And then once it is done, then it has to be stored in the complete frozen state itself. Once the milk comes to a normal state, it has to be given to the baby post pasteurization. If it is comes to the normal stage, within 24 hours, it has to be used. That is for sure. So we always make sure that it is completely in the frozen state from the time of collection to from the time of till the time of pasteurization. Only during the pasteurization time it will be liquidified, and then post pasteurization again it goes into the fridges, as you can see in the next slides where Shanti ma'am have kept. And then after collection, what we will be doing is the first step is under aseptic conditions, that is the biosafety safety cabinet or the laminar flow we call it as. We will pool in our hospital setup, we can pasteurize 500 ml of milk per one cycle. So if it is like only the mother has donated, one mother has donated 300 ml of milk and other mother has donated 200 ml. So we can mix these both and then we will do a pooling. Pooling is nothing but stirring of
Oh,
all the milk of both the
oh,
mothers in a beaker. Okay, that we
okay.
will
Wow.
do under the laminar flow.
Yes.
And then we will put it into the pasteurization unit. The pasteurization will take its own time. You can see, and then after the pasteurization is done, before the sorry, and before the pasteurization, we will send a 10 ml or 15 ml of milk for the culture. And
Okay.
post pasteurization also, we will send 10 ml of milk for the culture. You every time, why these culture reports are important. See, post
Yes.
pasteurization, if the cultures are positive, we are going to discard the whole
Serenity.
milk and all the area to be thoroughly disinfected.
Okay.
If it is, sometimes what happens is pre-culture it will be positive and post-culture it will be negative. So that means the
Hmm.
pasteurization process has killed the bacteria what has grown in the mother's milk. So that is now safe to give it to the babies. So
And
what
one
is the
more
process?
thing, just a minute, just a minute. I have my own query, like as you were rightly explaining us the process of the
Yes.
collection right from the screening. So when w- do we have any portal where mothers they connected to you
Can
saying that they are likely to donate milk? Like how
donate
do
the
we
milk,
connect with
yes.
them? Like do we have any
So,
mechanism or it is
so
a yeah,
yeah, now as of now, I do take care of antenatal and postnatal
yeah.
mothers as well. So we have a WhatsApp support group for all the discharged mothers
Okay.
from our hospital, from our
Ah,
unit.
yeah.
So post delivery,
Okay.
first they will be during pregnancy, they will be tracked under antenatal, and post pregnancy, I mean post delivery, they will be tracked under postnatal. So we will be doing that, and we have a separate flyer with that, and Pamela ma'am in her own communities and me in
Ah, okay.
on our own
Yes,
communities, we will
yes.
be trying to like rotate all those flyers
Yes,
around.
yes. Yeah.
So touch wood, mothers are very good and they are donating for our milk bank. Somehow we are
Yes.
managing together. We have our own
Yes.
mothers who got delivered here because they know the value of this tiny life. So
Yes.
Pamela ma'am is
Yes.
great counselor, great counselor. So that is
Okay.
the reason our fridges are always filled with milk for the
Yes.
Currently we are having, not currently, since we opened only, thankful to God, we are
you
having a
can
few
see, yeah,
mothers who have donated liters and liters of milk.
liters of
Oh, great.
liters and
Yeah.
liters
Oh,
of
great.
milk. Sometimes
And
it's like we will please stop for some time because we are not having the fridge to store properly.
Enough
yes, yes.
space.
Even I
Yeah.
wanted to ask also, when do you
Yeah.
say the mothers to stop? Because the storage also should
Yeah.
be an issue,
Yes.
and maybe the admission of the NICU babies are not have. I mean, they may
Yeah.
not have the indication of taking this milk. And I still remember, I myself have, referred one of the security personals,
Yes.
and
In
he
outside
contacted you.
hospital. Yeah.
Yes, Lalita, he contacted. It so happened that when I was passing by and I saw this milk bank setup. Yes, it is going very interestingly. Yes, and I think yes, Kisia, you wish to understand anything, and since we are just running a little out of time, yes, Kisia, I
My
think doctor has
question,
already told about
yes.
microbiological testing, etc. Anything else? Yeah.
Yeah.
Ma'am, I would like to ask, actually, you already explained the question I already wanted to ask, but thank
Yeah.
you. And that was a good information. And there is any more indications or is any safety to be done before giving to the baby, or because it is because during giving to premature babies we have to handle it very carefully. So if there is any safety or is any recommendation you have to.
So, Pamela ma'am, will you answer or?
Yeah, you can take over. No
Yeah,
worries.
see, so we will do this under very aseptic conditions, right from the collection from the day till the recipient has received it. So
Yeah.
usually we don't give these bottles and all to the parents. So
Yeah.
whoever it is who want the recipients, we will take the consent and everything for the recipient, and then the NSU staff itself, they will come to the milk bank, and we will write clearly the time of dispense and the date of dispense, because within 24 hours it has to be discarded, and that is
Yes.
also kept very sterile with the baby name and everything. You can see, ma'am, next slide. So you can
Yes.
see, and
Yeah.
then we
Here. Yeah.
yeah. Recipient, batch number, dispatch date. Because we, after the post pasteurization, we can keep only up till 6 months. So we will write the expiry date of the milk also. So, and within 24 hours we have to discard. So every micro monitoring we will be doing, and then we will be giving it to our tiny babies.
Yes, yes. So it was, yeah, I think, yes, it is just like one of the medication, what we always get to see on our, medication vials, and we treat this as a biological medication itself. Yes. And I think these are the advanced technology which we have in our setup. And yes, Priya, I think, yes. Dr. Pamela, are you there? Okay. So, yeah. So, Priya, yes, over to you. You wish to understand
Yeah,
a
ma'am.
few things. Yeah.
Yes, ma'am. Already, like the unit of our Yashoda already have a very sophisticated equipment over here. Ma'am, throughout the process, like in the entire process, which part you find like an essential, crucial part of the process, ma'am? Because here we can see in the fridges that is purely allotted for the storing the milk. It has been labeled that do not dispense and safe to dispense. What does it actually mean?
So
How do
one,
you segregate? How
yeah.
do you
So
grade it actually?
yeah.
Yeah.
So I'll make it simple. So once the mother, we collect the milk from the mother, we keep it in the do not dispense fridge. Okay, the collected milk, all the collected milk, and in the top rows, first 1 and 2 rows, the milk which is pasteurized, but the report yet to come, the report culture report
Yes.
yet to come milk will be kept in the top rows.
Top shelf.
Topper.
So
Yeah.
once
Yes.
the
Okay.
report is negative, then we will shift it to the safe to dispense.
Safe
Safe
to
dispense is
dispense.
the final rack from where we can dispense the milk. It's very simple.
Perfect.
Yes. And what is
Perfect.
the
Perfect.
temperature storage criteria
Minus
for
16.
this?
Under minus 16, we have to store it.
Under minus 16. Yes. Yes. And how
Under
long we can store this milk
6
for?
months. 6 months.
6 months.
6 months
With
under this temperature, and from the time of post pasteurization culture report
yes.
negative.
Yeah.
Yes. And I think
Okay.
we have not seen this hot. What is the
Hot air
functioning of
oven.
hot
Hot
air
air.
oven?
I told you when we will pool the milk in the beaker, I
Yes.
said, right? So that beaker also should be very aseptic, like very sterile.
Yes.
So what we
Yes.
will do is
Yes.
with mild disinfectant, we will wash, and we will keep
Sterile.
sterile all the glass items in the this hot air oven, so that it gets sterilized and then used. Autoclave is for the pasteurization steel containers what we used in the pasteurization unit. So
Correct.
every step, the containers, even the containers what we use, and for the hand, the glove and everything will be very under very sterile procedures we will be doing in our hospital.
Yes, and I think that is the
Yes.
use of this great technology which we have in our setup. Yes, I think. Yeah, and yes, at last
Ma'am,
we
do
have.
we have any indicators, ma'am, to know that the milk is like still good? And as you said, 6 months is the time period where we store it. And
Yeah.
do we have any indicators over that particular breast milk container or package, whatever you say, like it's still in a good condition? Do we have any such
You,
indicators?
you
See,
mean to say the efficacy or potency or efficacy of
Yes.
that particular milk?
yes.
Okay.
So,
Yes.
yeah,
Yes.
see, every mother is different, because a preterm mother at 25 weeks, weeks mother a mother who got delivered at 25 weeks will produce a different type of milk. A mother who is like, mother is having a toddler of
Yeah.
1.5 year of age will produce
Yes.
differently. So
Yes.
we have a protein analyzer, but we don't have this at our unit now. But there is a protein analyzer and a carbohydrate, all the terms like protein, carbohydrates, and
Yes.
minerals, or there is an analyzer machine, but that is little costly.
Yes.
So in that, if we just put 5 ml of milk,
the milk.
then it will give a
It
detailed
gives you
analysis
the
and report.
nutritive components.
Yeah.
Yeah.
So maybe in future that is our next step to go to get
Yes.
that protein analyzer so that we can analyze each and every baby need and then we can give
Yes, yes. Or a kind
to the
of
mother.
biological integrator. Yes, yes. That is
Yes.
very
Yes.
interesting. I think Kezia and Priya, and you should bring a few. I mean, voluntarily, you should visit our setup and see, because we are now
Yes, ma'am.
presenting, but when
Yeah.
you see with, practically, then it makes a lot of sense. Yes. So, yeah, we have come to
Yeah.
the last of the slide. And Dr. Pamela, are you there?
Yes.
Or,
I
yes.
don't.
Yeah. No. So, are there any myths related to donor milk? Because I think she's cleared in the beginning only. Is it
So
going to be
most of the
safe?
session
Should I?
answered all our assumptions and
Yes,
all,
yes,
ma'am.
yes,
So
yes,
anything which you feel like needs to be covered, and especially do the if we do donation of the human milk, do mothers think like few mothers think like the quality and the quantity
Yes.
of their milk will be like compromised. Do
Yes.
you do what do you say about it, ma'am?
There are myths because if the mother being educated, she is willing to donate, their families are not willing to make them to donate. So it is like
yes,
we
Yeah,
have
this
given
is
the
the main.
containers, they stored
Yeah.
the milk, and literally they have dumped everything into the wash basin.
yes,
So there
My
are
God.
instances like that also. But we had to show our NICU babies, the tiny babies like 600 grams, 800
yes.
grams, and then you can save a little life, and that empathizes them, so the
Mm.
sensitivity part gets touched, and then from then onwards they're
Then,
like giving.
then the
So
change happens. Yes, and yes.
Yes.
So I think within 20 minutes we cannot just talk about this topic. It is very touchy topic, and when empathy
Yes.
comes with a lot of passion and care, yes, and I know Dr. Pamela is, we are traveling, and yes, I urge all the and request all the viewers to refer www.yashodahospitals.com for more academics and also watch patient testimonials for virtual based and evidence based learning. I thank Dr. Lalita, thank Dr. Pamela, Priya, and Kesia. We end the session, but as this is the awareness, please share the link and many,
Yes.
congratulations for your presentation. Thank you, and we end the session. Thank you,
thank you.
Dr. Lalita. Yes.
Thank
Thank
you,
you.
ma'am. Thank you. Thank you so
Thank you.
much for the opportunity.